My name is Brenda. I'm a grandmother and a great-grandmother. Me myself, I've been in 2 comas, almost in the third one this past month. That's how I ended up meeting my girl Vanessa. She's been a guardian angel to me ever since.
Hey, my name is Vanessa Muhammad. I am the Acute Liaison Care Coordinator at Access Community Health Network. I've been in healthcare for approximately 40 plus years, and I just always have this love for nurturing and helping people and wanting people to be the best that they can be. I want to be that spark in their eye to let them know that hope is still alive, and we're here to help them navigate through this whole healthcare management and making sure everything is going well with them. Typical week for me, if I'm not at Holy Cross, I'm at Mount Sinai or Metro South. I went to visit Brenda. She was on her way to be discharged, and I introduced myself to her. Hello, Miss Brenda. How are you feeling this afternoon?
I'm okay today.
Some wonderful news to share with you.
Let me guess, I'm not going home.
You are going home.
Yes. She helped me out in everything. I mean, everything I needed.
Expressed my role to her and told her I was here to make her life as stressless as possible. We connected with her primary care physician, her medical home connection, and that we would provide a nurse care coordinator for her as well.
She helped me out. She got me in to see the doctor the next day at Access.
The care coordinators that work in the hospital are another addition to our care coordination team. Some of them work in the health centers and some work in the hospital. And when you're in the hospital, you have that direct link to our patients that are actually in the emergency room. And occasionally patients use the emergency room correctly. I'm having chest pain, let's go to the emergency room. And sometimes they use them in a way that's probably not appropriate.
I feel if the care coordinators were not embedded in the ED, then we would have a high rate of repeat patients going to the ED for minimalistic concerns. We can navigate through the system at any site, so no matter where they are, we're able to assist them.
It's hard to sum up the value of a care coordinator in one sentence. They bring a lot to the table for the patient and the provider. And I think having the care coordinators to make sure that the patient gets in is a good thing. Ms. Booker is a perfect example of that. She is a former Access patient that was reclaimed by having a care coordinator in the hospital to catch her there, coming to get her refills for her COPD. A patient with chronic, severe COPD needs to be seen a little more often than every 3 years.
Once we do the initial assessment with the patient, we ask them a list of questions to find out what criteria they are in, primarily if they're high risk, medium risk, or low risk. And of course, Ms. Booker is definitely in the high risk category because of COPD. I'm working with her to build up her health, to make her sure that she's eating a proper diet, teaching her how to exercise because she's pretty much not bedridden, but bed dependent. I told her there's arm exercise she can do while she's sitting there watching television, or she can do the crisscross with her legs just to get some mobility. I want to make sure that she's keeping healthy and active.
I think with our partnership between Access and Holy Cross Hospital, one of the big advantages is that we are really patient-focused, and we are really trying to ensure that we can improve the health of our communities. Case management over the years has been evolving. I started in the emergency department where we worked to try to connect patients with outside services. It was very difficult. It was often hard to get a hold of physicians. So over the years, we've evolved. Currently, we have Access case manager that is embedded in the emergency department, and this allows us the opportunity to be able to link patients up. So it actually adds a lot of beneficial services, even as far as arranging transportation, getting timely appointments, and then the continuity of care.
It's been an amazing experience being here at Holy Cross. Everyone is warm and welcoming. We're all together working for the one cause, which is to help and save lives. I love being a care coordinator. I love helping people. I love taking care of people. And that resonates through me, and the patient sees that there's someone on the other end that definitely cares about their health maintenance and well-being.
She just helped me out so well, so good. And she just won't stop. She just won't stop. And I'm not gonna let her stop. She puts me back on track.